I'm tired of treating ulcer. I've been treating it for how many years now? This is what I hear almost on a daily basis in the pharmacy. As some of you know, I'm a pharmacist and I have practiced for over 5 years. And in my 5 years of practice, I have seen a lot of people complain about ulcers, especially stomach ulcers. And personally, I have experienced ulcer, and unfortunately mine was early onset at a very early age. By 9, I had ulcer. In this video, we're going to find out what ulcer is, what the causes are, what the triggers are, what foods to avoid and what foods to take, and what the treatment is. So if that's what you're interested in, stick around. Hi beautiful people, welcome back to my channel. My name is Kosi and I make videos about faith, beauty and lifestyle. If you are a returning subscriber, you're a darling, welcome back. If you're new here, please do well to subscribe. Ulcer, the umbrella word is peptic ulcer disease, and under this peptic ulcer disease we could have gastric ulcer, which is the most common, esophageal ulcer, that's of the throat, then of duodenal ulcer, that's like of the intestines. But many people, what they come down with is gastric ulcer. So now, what is ulcer? In simple terms, ulcer is the breakdown of the mucous membrane. Mucous membrane is just lining. In your body, there are linings in your body. For example, in your stomach, there's a lining covering it, protecting it from the acidic content in your stomach. So when ulcer sets in, it means that that lining is broken down. So your stomach now has sores. It's just like an injury. You're having injury. It's like maybe there's acid poured on your hand, you start seeing injury, sores there. So that's what happens inside your stomach. Trust me, it can be so painful. I have experienced it personally and I know that it is not funny. And because I work in community pharmacy setting, I get to see almost every single day someone is coming down with the complaints of ulcer. So it's so common. Now, what causes ulcer? The truth is that there are a couple of factors, but the most common one is a bacteria called Helicobacter pylori. That's the causative organism. Research has found that up to 50% of the world's population have this bacteria in their gastrointestinal tract. Some people do not know. About 20% of the population are asymptomatic. They do not have signs of ulcer, but they may have ulcer. So we're going to talk about also the symptoms. But first, the causes. We've talked about Helicobacter pylori being the major cause. Then we have NSAIDs. NSAIDs are like painkillers. You know, maybe you're having some joint pains, then you go and pop some pills like maybe diclofenac, ibuprofen. Many ladies take Felvine, especially when they have their period. Felvine is a painkiller which will term NSAIDs. So if you take it in excess amount, if you take it too much, especially when you're on an empty stomach or basically abusing the drug, you are probably going to come down with ulcer. Another cause could be some drugs like chemotherapy drugs, and for some people undergoing chemotherapy, it could lead to ulcer. Then stress. Stress is a very big trigger when you're extremely stressed. Your gut flora, your gut health has a way in affecting your health. So if you're stressed, if you're not eating properly, you see all these things, they have a relationship. We'll discuss that in another video. But for now, just know that stress also can trigger ulcer. I'll just quickly share something that I experienced. A patient came to the pharmacy and she complained about pains also. So I asked her, bring whatever medication you're currently on. She said she went to a chemist. Mind you guys, there is a difference between pharmacy and chemist. I made a video about this. Please go and watch it. There is a difference between chemists and pharmacists. Some people that run chemist shops, they just run it to make money. They don't really care about the patient's health. So she brought these medications and I found out that they mixed drugs. You know what they call mixing, which is so annoying. They cut up drugs for her, about 3 different drugs. and one was ibuprofen, one was diclofenac, another one was diclofenac, and they all asked her to take the maximum dose of each drug. That's an overdose. She was asked to take an overdose of these drugs, and if she keeps taking it, obviously she's going to come down with an ulcer. And many people are victims to this. They are ignorant about the effects of painkillers on your stomach, especially when you abuse them. So please, when you're in pains, you need to see your doctor, your pharmacist, get proper treatment. Don't just go popping pills and taking pills anyhow. Now, we'll quickly talk about the symptoms. What will you experience when you're having ulcer? You're likely to experience indigestion, bloating. It feels like the food you've eaten hasn't gone down, it hasn't digested. Your stomach feels so big, there's so much gas, you can't even belch or pass gas. You are just feeling so uncomfortable. The discomfort is so annoying. Then there's pain, especially after eating. Maybe 15 to 30 minutes after eating, you experience pain in your stomach. Then sometimes you experience pain that radiates to your back. It can be really painful. You experience sometimes even vomiting. Sometimes when it has gotten so bad, people start to stool blood and vomit blood. But in the early stages, the basic things you will find is bloating, indigestion, pain in your stomach. You may be feeling a burning sensation in your chest or heartburn. So these are like the common symptoms you would see when you have an ulcer. Now let's quickly talk about foods that can trigger ulcer. Spicy, peppery foods. My Yoruba friends can relate to this. There is a video I saw on Instagram. After she cooked a meal and gave to her friend, she put an antacid by the side. Obviously, you can tell that that food is going to trigger that pain, that ulcer pain, especially if the person already has ulcer. Things that can trigger it is some fruits that are acidic or citrusy, that have citrus acid, like oranges, lime, lemon, sometimes pineapple for some people. And you have to know your body. There are things that may trigger it for me that may not trigger it for you. But generally, things that like beans can trigger it for some people. Alcohol triggers ulcer as well. So I want you to take time to observe yourself. If there's any food that you notice that doesn't sit well with your body, you need to cut down on it or stop it entirely. There are people that I'll meet and they will say, this ulcer, no, they go. You know, they go. I don't tire. The truth is that it's like a sore. If you have a sore in your hand and it's healing, and you do things that will trigger the pain or open the sore, it's definitely going to come back. Your healing process will be reduced. So once you have started taking treatment for ulcer, please take this treatment well and avoid triggers, things that will trigger it. It may be difficult. Maybe it's your favorite things that even cause this ulcer pain for you. It's unfortunate that that happens sometimes, but your health is very important. You need to cut down on your triggers, take your medication, and you will be fine. I've been free from ulcer, well, to an extent. Triggers for me are NSAIDs. If I take painkillers, they trigger the pain. So I try not to take too much, NSAIDs. So whatever your trigger is, please identify your triggers and stay away from them, okay? So now we'll talk about foods that you are encouraged to take if you have ulcer. Things like milk and Greek yogurt. Personally, I am talking from experience now. The last time that I had an episode of the ulcer pain, and it was at night, so what calmed me down was yogurt. I usually have a bottle of yogurt in my fridge. So once it comes, I take it and it helps to calm me down. And taking leafy vegetables like ugu, spinach, these things are good to take, but they should be properly washed, because if they're not properly washed, that could be another problem for you entirely. Then you are encouraged to take fruits like banana, cucumber, watermelon. All these fruits are really good, but just be careful. Like I said earlier on, citrusy fruits should be avoided. Then you have things like fish, Seafood is really good. Seafood prepared well, things like mackerel and sardine contains omega-3 fatty acids that are helpful in your ulcer healing journey. Cabbage is really helpful for people with ulcer. But now we'll talk about the drugs that can be taken. Antacids. There are many antacids like Gestid, Rulox, Gaviscon. I'm not going to start calling different brands now. But antacids help. They help to quell the pain. The pain can be so overwhelming. Then cimetidine. Personally, that was what I was placed on as a child. When I was 9 years old, I was placed on cimetidine. I took it for a couple of weeks. The truth is that ulcer can be really stubborn. You need to take your medication. When you've met your doctor or your pharmacist and they've advised you to take antibiotics, please take it well. Do not abuse your antibiotics. Like I said, one of the causes of ulcer is a bacteria. If you are asked to take an antibiotic to kill this bacteria, you need to take it well. And usually you would take it for nothing less than 2 weeks. Nothing less than 2 weeks. Usually at least for 2 weeks. There's omeprazole, proton pump inhibitors. Like I told you earlier on, there's acid in your stomach. So what this drug does is to reduce the acid pumps in your stomach. That's simple terms for you to understand. So you will be placed on this medication for a certain period of time. However you are asked to take it, please do well to take it properly. I hope this video was helpful to you. If it was, please like, share, comment, and let me know what you think. If you have any questions, please let me know in the comment section down below. Thank you guys for watching this video. I'll see you guys in my next one. Bye!